So again, many of our men and women out here join for the educational benefits, also for the health benefits, and which in fact they're finding that sometimes is not as what they thought was going to happen. So again, if I may ask all of you, let's give her a great big hand because she's doing a wonderful job.
Thank you, Senator. I think one of the things I wanted to just bring up, following what the Senator has said, has been working with the committee has been great because it's allowed us to look at providing some of these services in kind of a non-traditional way. What we're doing in Illinois is we're actually accessing non-DOD, non-VA providers, especially for things like the mental health services. And the fact is that there are not enough mental health professionals within the VA, so we are actually going to access the network. We have some fine universities, some teaching hospitals. We have the Rehab Institute, of course, the entire University of Illinois system. Why are we not accessing these services in terms of medical care for our veterans? And so in Illinois, we're going to pay for that. The federal VA rarely lets their veterans access outside care. I actually, instead of going to my federal VA, I go to my federal VA hospital for all my medical care with the exception of prosthesis because I've been very disappointed. I actually fly back and forth to Walter Reed where I get my prosthetics cared for. So I pay for my trip back to DC out of my own pocket. Yet we have the Rehab Institute and we have some great prosthetics program that I really can't access right now. Which is just, but we're doing that at the state level.
Okay, we have time for one more question.
Hi, Director. Thank you for coming out. I'm representing Senator Watson. He couldn't make it today. I do work on the vets budget, and so I am familiar with a lot of the programs, the homeless program with Mantino, and some of the other issues that our vets are facing. You threw out a couple numbers, and I just wanted to know if you had stats for Illinois. You stated that there are 8 million vets kind of returning to the system. Do you know how many of Illinois veterans are returning to the system from like the Vietnam era, I believe is where?
There is no actual number. You will have to do a percentage.
Okay.
There are 24. I'll give you these pieces of paper if you want them. They're actually VA reports. Total living veterans, according to the VA, this is as of 2005, which is the most recent number available, is 24,387,000 total living veterans across the nation. And of those, 8 million are Vietnam War veterans.
Okay.
Illinois has 1.2 million total veterans.
Okay.
So it becomes a percentages issue, and it goes back to this whole self-reporting. We only know about the Vietnam veterans who actually went into the federal VA and said, I need help, and submitted paperwork. If they don't do that, we don't know that they're out there. But I can give you those statistics in electronic format as well. And by the way, Representative Watson just re-enlisted in the Marine Corps after he served during the Persian Gulf War, got out, and just recently re-enlisted in the Marine Corps. So I'll have to wait until I'm in uniform and go pick on him one day, because I think I outrank him on the civilian side. In the military side, I mean. Yeah.
One other thing, you talked a lot about post-traumatic stress disorder and how serious it is. I know that the Vets Care program has a component in there for PSTD. Do we know how many veterans are currently enrolled in the Vets Care program? And then what are we doing as a department to kind of get the word out and get people who would qualify for those benefits? I know in rural areas sometimes the word doesn't get out as well, but as a department, what are we doing to kind of get people to understand that the program exists, the benefits are there, and then how to enroll them?
Right. The issue with Veterans Care is that we are rewriting the rules for the Veterans Care. Veterans Care is Illinois, and we're the only state in the nation to provide this. You're going to hear me say that a lot because Illinois literally is the only state in the nation providing a lot of these benefits. Veterans Care is affordable health insurance for veterans. Unfortunately, when it was written, some of the rules did not address the situation of veterans today. For example, one of the rules under Veterans Care, which we are changing right now, is that if you qualify for VA health care, you do not qualify for Veterans Care. And as I said earlier, you could be considered qualified for VA health care but be an 8 that to me is the same as not being qualified, not having access to health care. But under the current rules of veterans care, they can't access veterans care. We're also changing the rules of veterans care where our National Guardsmen and reservists, because they do the 1 weekend a month, for those 2 days of the month they have health care, and that eliminates their eligibility for veterans care. So there's a lot of those rules that we're changing. Right now, veterans care is doing its job in being the absolute final safety net to catch veterans who have fallen through every other safety net, and we're catching them in veterans care. But I'm hoping to expand the eligibility requirement for veterans care to include even if you qualify for VA care, if you live more than 50 miles or an hour's drive away from the nearest VA facility, that should be a clause that allows you to access veterans care. Because if you live in, as I said earlier, El Paso, Illinois, you don't have access to VA health care. You're too far away. And that young man should be able to access veterans care. So we're definitely changing that. And that is with the help of both the House and the Senate committees to rewrite those rules and make that more expanded. But again, as that expands, the price tag for that comes back to the state of Illinois.
I'd like to thank everyone for coming, and I'd like to thank Director Duckworth for this excellent presentation.
Thank you.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois. If you have any comments or questions on our programming, please email us at illinoischannel@aol.com. Or if you have any questions about the Illinois Channel, please visit our website at www.illinoischannel.org.